One of the best parts about technology is that, once you develop it, it does require ongoing maintenance and updates. So it's not sort of, it can last forever. But there is the ability to disseminate, far and wide if successful. So, our hope is that once designed in the research context, if any of our interventions are effective, that we'll get them out and we'll get them out to the population that need them. I would say the other goal is that I think a lot of investigators are creating apps and websites sort of in silos, in isolation, and almost recreating the wheel every time to make a new app that maybe does the same thing, only slightly different as another app, for maybe a different disease or a different population or even the same population. And so I think our hope with the iTech is that we start to create a center where we can share ideas, we can build off of successful platforms, we can start to talk about things like open source software to actually spend money wisely and effectively. And I think, again, when we talk about prevention and treatment, that is something that needs to be considered so that we can actually use the resources that we have wisely. The funding, at least currently, is to address the domestic epidemic, but my colleagues and I have been working, around the world and starting to create collaborations to do this globally. We're actually in South Africa teaching a course on mHealth and how to use mHealth to design HIV interventions in South Africa. So there is a lot of interest, and again, the pace of smartphone acquisition and internet access continues to increase rapidly globally. And so I think that a lot of these interventions would and could and should be adapted for a global context. I came to UNC in 2001 to do my infectious disease fellowship, and I have been here ever since. I trained in internal medicine at Stanford and again came to UNC because they were leaders in HIV, and the HIV epidemic was really, at that time was raging in the South. And so since the moment I got here, I've really been focused on HIV infection and really focused on youth, particularly young men who have sex with men of color, and again, haven't really sort of ever thought about going anywhere else since I got here. There's no other, I think, disease that has made as much progress, at least in my opinion, as HIV. And we've gone from, when I first got here, we were still treating HIV infection with multiple pills many times a day that made people really sick, that they didn't want to take. And now we treat HIV with one pill a day. And I think that in some ways that's sort of magical, that you can treat HIV infection with one pill and that people can live normal, healthy, long lives and do everything that they were planning on doing before they were infected. And so, I think that's amazing progress. I think that there's still things that keep people from taking that pill every day, from getting tested, from preventing HIV infection, from going into the clinics and seeing providers and picking up their refills. And I think those are issues that are really important to me that we continue to address in the next 15 years. Lack of access, stigma, discrimination, inequity in healthcare. And I think those are the really important issues because we have the tools to prevent HIV and to treat HIV. But it's making sure that those that need the tools have access to them and utilize them most effectively.